I don't believe that lidocaine has any role. It should work with some time, and secondly, it should be in contact with the surrounding tissues and nerves.
Okay.
So mixing this with the filler.
I'm the opposite of you. I believe in lidocaine. Lidocaine works very, very well, and I'm speaking from own personal experience. Okay? And at the same time, all the studies look at it, and they've noticed that the pain factor is much less when compared, for example, to a product that does not have lidocaine compared to one that has lidocaine.
Which type of pain? Injection? The break? The break?
No, the prick. You see, if you are
It's the only pain they feel, but later on, there is no pain.
No, there are a number of... No, so hold on. Let's go back again. If your product is thick, for example, like Radiesse, or for example, like, Polycap or Elonstay, and you're injecting it, patients are going to feel pain. Because there are two reasons for that. Because it contains glycerin, and at the same time because of the whole expansion that happens. It's like this excruciating pain that they feel. So that's the reason why if you put lidocaine, it really calms them down. The initial prick, I agree with you, but what I usually use is that I use ice. I don't do Emla. I don't do blocks anymore. Yeah. All right. So we're going to start injecting. All right. And I can see you guys later on, and then we can actually answer more questions. Okay. So our first patient. Let's our first patient, please. Sponsored workshop, which is, I believe, is good. Okay. So it's not commercial. I'm not trying to sell Restylane or Radiesse or whatever. Okay. So I'll tell you the good and the bad and whatever you want. So it's not a company. I'm not a company person. Have a small? Yeah, I'll try. I'm usually medium, but I'll say. They're the ones, as dermatologists, been using needles. But that kind of shifted now. It depends on the area that I'm actually injecting. I do both. At one time, it was mainly 100% needles because that's what I was trained at. Then when I learned how to do the cannulas, I just mainly shifted to being 100%. Cannulas are much faster for me. Just one opening, boom, 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 and I'm done. Okay, for the cheeks, it's just one opening here, one opening there, spread it out, and that's it, I'm finished. So it's much faster. It all has to do with that. Oh, so we're online. So let's look at the patient. Okay, so the first thing that you look at this patient, what is it that you want to treat? What do you see in this patient here that you want to take care of? You can see that. You see the video. See it there. So if you look at the patient, this is how she is. What do you guys really see? Yeah. So she's got really good cheeks. Okay. I don't know. Have you ever filled your cheeks with it? عملتهم ولا لسه natural؟ لا. عملها؟ Okay. أنا قلت خلت ربنا لا تطلع عملها. No, she's very good looking. Very, very good looking. So she does not, if you look at her, she does not need the cheeks to be done. Okay, so a lot of times we just jump in to do the cheeks. In her case, she doesn't need the cheeks to be done. But if you look at her going downwards, look at this. She's got a little bit of the tear troughs. Okay, so definitely her tear troughs need to be taken care of. Okay? And at the same time, her nasolabial folds are much softer, but at the same time, you could put just a little bit in the nasolabial folds to kind of fill them up a little bit. Not too much. If you put too much in the nasolabial folds, this and this become the same level. She'll look like a chipmunk, okay? And she'll look unnatural. The whole point here is for her to go home today, and nobody will know that she's actually had any fillers done. Okay? And once I do this, I usually, if I'm doing the nasolabial folds, I also put a little bit just on the sides over here, on the corners of her mouth, just to provide a little lift. Okay, that's what we're going to do today for her. Okay, so we're going to start off with the tear troughs. Yes, please. And especially on the eyes. Okay, so for the tear troughs in her, what I'm going to do is I'm going to be using Restylane in this area. Okay? Restylane. Yeah. Not Perlane, Restylane. It's very cold. This is near, it's just cold. It's very cold. لا اشتغل على فكرة. Perfect. All right. So we're going to start off. I'm going to be injecting Restylane here. Now, there is a little trick that I've learned at the American Academy. I'm not going to say that I created this little trick, but this is something that I learned at the American Academy. What they usually do is that they take. I'm not going to do it here, but I'm going to tell you what they usually do. Is that they take. Can you put the camera here? They take the Restylane, which is a 1 cc Restylane, and because remember this is an HA. If you put an HA in the tear troughs or any part of the skin that's quite thin, you might develop that Tyndall effect. So to try to avoid that Tyndall effect, what they usually do is that they put in a very small amount of radius. So we're talking about maybe 0.1. Okay, it's a very small amount of radius into the Restylane syringe. So you connect it with a female-to-female connector and you go back and forth. What happens is that you will have an HA that looks white. Okay, but I'm not going to do this today. But this is one little trick that you guys can use. Okay, so you can put a little bit of calcium hydroxyl oxide, 0.1, very small, not a filler amount, 0.1, just to change the color so that you try to avoid developing that Tyndall effect, which is that blue effect. Okay, another way to try to avoid the Tyndall effect is for you to inject very deep. Okay, so we're going to try to inject very deep and also a very small amount. The Tyndall effect happens because you're injecting A, superficially, and B, injecting too much. Okay, so very small amount, deep, you should not get a Tyndall effect, even if you're using something like an HA. Okay. All right. Yeah. And this goes. All right. So this is my approach when it comes to the tear troughs. The tear troughs, mainly, the definition of a tear trough is from the mid-pupillary line going all the way. I mean, you're not supposed to show the needle to the patient, but because it's usually from the mid-pupillary line all the way upwards to the medial canthus. Okay, so this is the area of the tear troughs, and this is the area that we're going to be treating. However, you do have to remember that if you are going to be treating this area, you want to run just a little bit on the lateral side. This is not part of the tear trough, but you want to run it a little bit so you don't have that step-off approach there. Very good. All right. I inject usually bevel up. It really doesn't matter if you're up or down, okay? But I usually just inject bevel up. This is what I do. Is that this is my index finger of the non-dominant hand, which is basically going to be the smart hand here. This is my dumb hand. This is the one that's only going to be injecting. I like to cover the eyes because I'm protecting the globe, and I'm also feeling where her inferior orbital rim is going to be. So this is the area that I want to try to basically inject, not go more up. I spread the skin just to see if there's any little small capillaries. If you see small capillaries, you want to try to avoid them. I don't want to cause any major bruising for it to happen. And then I am going to look at my finger here. I stabilize my hands on her cheek, so I don't shake. If I'm going like this, I'm going to be shaking. So I'm basically stabilizing my hand here, and then I'm going to be injecting. She's got a few veins. I'm going to try to avoid them, and then I go in. You feel okay? Is it better? Okay, so she should not feel any pain. Remember, I'm not using any ice. I'm not injecting anything. I'm going all the way deep, and I can feel that I'm just kind of very close to the bone right now. And then I'm injecting very slowly into that area. You inject and then you massage. Okay, so inject a very small amount and then you inject, and then you massage. Let's remove this.
Direction of massage.
No. The question is that is there any area that you want to massage and how you want to massage it? No, there's no actual area in which you're going to be massaging. So, whatever makes the patient comfortable and you comfortable. But if you're injecting the cheeks, as I will show you later, the massage, the way of massaging is going to be key. And now I'm going to be injecting that little medial canthus there. Spread it, no capillaries, then go in. I don't inject until I know exactly where I am. See, I'm pulling, do you guys see, I'm deep. I'm pulling the skin. Do you guys see, is it projecting well? Yeah. So you cannot see my needle, so I'm quite deep. Okay? And then I inject very small. Now, you're probably going to see it, because I'm going to see it here, that the medial canthus is going to fill up just a little bit. So it's filled up nicely as I'm coming out. And then I stop. Then I come out. Very good. And then you massage it in. Any questions? Okay, the question is... That's good. It's good. I'm glad that I have a person here who's asking questions. What is the danger area? Now, there's going to be there is usually no danger area very close to the eyes because there's no major vessels that are there. But remember, there is the inferior orbital foramen that's here where the nerve comes out. Okay, and you do not want to inject this area. And the way that you know where this foramen is, mid-pupillary line, draw it downwards. Draw another line from the tragus all the way to the nostril, okay, to the ala, and that's the point. It's going to be it's usually right over here. Okay, so we're more on the superficial side of it. I mean, superior side of it.
Hassan?
Yes.
Any possible side effect they expect?
Yes, immediate. That's a good question. Immediate thing that will happen, depending on the filler material that you're using, is usually swelling and edema. Okay, that happens within the first 2 to 3 days. More so with Juvederm compared to Restylane. Okay, in that area. But remember, this will go away. It doesn't last that long. It goes away within about maybe 3 or 4 days. It just completely disappears later on. But you have to tell your patients that they might get edematous.
How to prevent such a side effect? Do you think if any antihistamine or even steroid before injection, it may avoid this? Or
I mean, I don't think that there is anything because it's not an immunologic response that the swelling is happening. It's because the hyaluronic acid is like a sponge. It's just going to get water inside. I mean, theoretically, you can probably use a little bit of, either a steroid or an antihistamine, but all I can tell is that, for these patients, is just to give it some time. It will go away. Yes?
About the upper limit of the tear trough, would you go in the lid or not?
No, never in the lid. The areas of the tear troughs that you can inject this area over here, going all the way back. You can use the exact same syringe. If I wanted to lift her eyebrows, okay, you can also put a little bit of your filler right here on the lateral side to provide a little bit of a lift. Okay, but do not inject into the lid itself.
So the nose?
The nose? Here you mean?
No.
Huh?
The limits of this tear trough.
Oh yeah, the nose. Yeah.
The nose.
Yeah,
upper the lid. Yes.
Exactly, yeah. So immediately going to be the nose. Exactly. So it's mainly going to be the nose here. This is going to be the border, and you're all the way up to the medial canthus. That's going to be your most superior part. What I usually do is that I put in a little mini bolus here and then massage it in, as I just did.
Excuse me.
Yes.
Experience with one patient came to ER in our hospital. She has filler followed by redness. She went to the doctor, gave her antibiotic, and followed by Stephen Johnson. And we don't know the cause. Was the antibiotic or the injection?
No. It's not. Stephen Johnson probably is from the antibiotic. There has been no reported case of Stephen Johnson caused by filler. It's most probably is going to be it's from the antibiotic.
is Stephen Johnson syndrome?
Yeah.
After the filler?
Filler, she got in redness, went to the physician, she gave me an antibiotic. And we don't know from filler or from antibiotic.
A little bit. I've injected about 0.1 on each prick. So I've injected a total right now of about maybe 0.3 just for the whole area. And this is more than enough. I will not inject any more. Okay, because like I said, it's going to swell up just a little bit. So I'm going to stop right now, and then I'm going to move to the other side. Okay, very good. What's that? Do you guys see the difference that you? Yeah, she's there. There we go. So this is the treated area, okay, and this is the non-treated area. You can still see the tear drops there, but the other side is filled up nicely. Okay, so you guys you can tell the difference, right? Yes. All right, very good. And another way to tell the difference is to have them lean forward. Okay, you can see it a little bit better when she starts leaning forward. There's a little bit too much flash, but you can definitely see that this one is a little more on the darker side. Okay? Alright, very good. Alright, what I want to do is that I want to try to show as many patients as possible. So what I'm going to do is that I am going to inject another part of her face, and then I'm going to ask another patient to come in. And then at the end, I'm going to correct these patients while everybody can leave. Is that okay with you? So I'm only going to inject one part of the face. Okay, so I'm going to, after injecting, now you've learned how to inject the tear drops. Let's have you relax. Now I'm going to show you how to inject a little bit on the nasolabial folds. Everybody knows, but I want to show you my little trick injecting the oral commissures. I'm going to change the needle. Any questions?
The left is deep dermis and not supraperiosteal.
No, I mean you're supraperiosteal. And then for the tear drops? Yeah, but yeah, you're supraperiosteal. Yes, you're very close to the bone. If you remember, there's no fat here. So it's skin, okay, then immediately there's muscle. Okay, so you're not going to be you want to be underneath the muscle. Okay? So if you're underneath the muscle, then you are right next to the bone.
This is the right hand for this area.
Yeah, for the tear troughs, that's the correct area. You do not want to be superficial, because remember, superficial, you have Tyndall effect. Okay? So you don't want to do that. And also, the volume. This correction with only 0.3. If you put in too much, Tyndall effect. Okay? So you want to be very, very minimal in terms of the amount that you put in. Okay. Alright, what I'm going to do is that I'm going to show you how to do it on the corner of the mouth. If you look at the corner of her mouth, step again. Okay. So, forward. Okay. So what we're going to do is that we're going to lift this area up just a little bit to give her a little smile. Okay, and then you're going to compare both sides. Now remember, she's a little bit asymmetric. This area is a little bit low on it to begin with. Okay, but what we're going to do is that we're going to lift this up so that she has a much more youthful lip. Sometimes you don't need to fill up the lips. You just need to put in just a very small amount here on the oral commissures, provide that lift like that, and she'll look fantastic after. So let's have you relax. This is my approach. I'm not correcting the lip. I'm just providing a little lift. Spread. Find out exactly where the oral commissure is, which is right over there. As you can see it right on that area. Let's have you turn this way. There, perfect. Good. I come in on about 1 centimeter to the side, and then I go in. Okay? And then I will go downwards. I'm right on the lower lip, and then I'm going to inject a very small amount as I'm coming out. Very small amount, very small amount. And then I end up. And then I turn my needle upwards. And then I inject also a very small amount going upwards. So I created that little C. Okay? So if you look at her, step again. Step. If you look at her lips, you can see that there's a little lift that she just developed right over here. Very subtle, but also very natural. Okay, so you need to massage it just a little bit to, completely fill it up. Okay, but do you see the difference between the two sides?
Yeah.
Alright, good. And it's a very simple, just one entry point right here in the lateral commissure, going down and going up to create a C. Okay, that's what you're trying to do. You're creating that C in the oral commissure. Sit back. Sometimes you want to support that C by putting a very small amount just underneath, because you've built the block, you want to provide support. It's like building a house. You want to provide a little bit of support underneath. Put a very small amount right over here. And that's Yes. Very good. This is what we're doing. And then massaging. Okay, massaging is very, very important. That's it. So that's all she needed. She didn't need anything more, much over there. I'm going to do the exact same thing on the other side right now, so because we can do that because we do have a little bit of time.
If she asks you to do the boundaries,
we have another patient who will do it.
I mean,
Yeah.
if the patient insists about this,
Yes.
and never you will inject the periphery only.
I will inject, if she's asking me if she's asking me for lip augmentation, this is how I usually start. I start with the boundaries first, including the corners. And then I ask the patient to look at themselves in the mirror. If they're happy, most of the time they're happy. They don't need volume. They just wanted that little contour. So after they do the contour, they're happy with it. I say, that's it, we stop. Okay? Sometimes they want a little bit more, and then I start adding the volume. But always, whenever you're doing lip augmentation, do the borders first. Okay? And then ask the patient to look at themselves. And then, if they want more, then start doing, the volume itself, the lip itself. But most of the time, you're just treating the vermilion.
So the same session, or 2 weeks, but it's
Usually the same session. Now, the question is that which filler you want to use for the lips? Which fillers do you guys use for the lips?
It's the finest.
Which one?
Finest.
What, fines?
The soft and finest.
The fine one. But in terms of, I'm going to tell you, because like I said, this is a non-sponsored workshop, but do you guys, which one uses Restylane for the lips? Let's show of hands. Okay, which one uses Juvederm? Okay. Alright, let me tell you the little trick here, or what I usually tend to use. Alright, for the vermilion, if I wanted to treat the vermilion, just the vermilion, I like using Restylane because it's a thicker product, so it provides a very sharp vermilion. Very sharp. Okay? But the Juvederm is very soft, it's very nice, it's excellent for the lips. I love Juvederm for the lips. But if I wanted the lips to become a little bit more on the juicier side, so if I wanted to provide volume for the lips, I inject Juvederm. But if just the vermilion, if a patient has very nice full lips, she just wants it to become very, very, very well defined, I use Restylane there. But if she's a patient who's never had anything done on her lips, I'll probably use Juvederm to provide that little softness. Juvederm is a little softer than Restylane for the lips.
Okay, what about UCL? Kids and global.
Okay.
You can do global for contour and kids for
Okay, so the people from TCL will kill me. Okay, but I do not like TCL Kiss. I do not like it, and the reason for this, and I usually don't say that, because it just causes too much swelling. It causes so much swelling in the lip area. For me, Global Action in the lips is much better. I know they're working on a new filler for the lips right now to kind of change their TCL Kiss. But I like using Global Action for the whole, for the whole lips. We do have a very small amount. I'll keep that for her tear traps later on, so we'll keep this here. Alright, so we're set. Okay. Alright, so we are done with the lateral side of the lips. Okay, so we're done with this patient here, so we're going to ask for our second patient to come. Do we have the radius? Okay, very good, finally.
to continue this way. Okay, what and basic and so on.
And they're good, but they don't last that long. They don't last. They last about maybe 3 months, but they don't last for a good amount.
This is an ideal patient.
This is very ideal, yes.
Yes, those are results.
Right. But most of the time, that's a good question. Most of the time patients are not going to be ideal. They come in different shapes, different sizes. Okay, most of the time, usually they're a little bit on the older side. But it's the same thing. What you're trying to do is that you're trying to recreate that youthful appearance at the end. So, it's all the same basic technique.
A lot of them. Sometimes they are not. Sometimes they are disappointing. You can, but this patient is perfect patient. I'm right or wrong?
You are. When I saw these patients, I'm going like, "What are you doing here? You look perfect." Yeah.
For CBT, are you using the same dose, same size, or your own gun?
Now you use your eyes. But most of us, everyone, okay, we are not symmetric. Our bodies are not symmetric. If you look at me, I'm not symmetric. I look at you, you're not symmetric. Everybody is not. Everyone has asymmetry. So what you're trying to do is that you're not trying to create symmetry. You want to try to bring them a little bit close to each other. So maybe one place might need maybe 0.4, another part might need maybe 0.6. Okay, just because there's a little bit of asymmetry that happens. So don't say I'm using 0.4 here, I have to use 0.4 there. No, you have to use your eyes. Alright, so this is I've filled up my lidocaine here. I'm using lidocaine. It's 2% without epinephrine or without adrenaline. What I do is that I push it upwards, and do you see the bubble that just formed? You see it? Yes, you see it. Yes, you can. So it's right over there. So I'm going to use 0.3. Okay, because remember it's 20% of my 1.5. So 20% of 1.5 is 0.3. After I take that bubble, the reason why I have to do this bubble is I want to get rid of the dead space. So there's no air now. There will not be any air bubbles that happen. Then I connect this here, turn it around, lock it very nicely, and then just simply bring it like this and go back and forth. Okay, just back and forth. Okay, very gently. You don't want to do it very, very tough. Okay, you want to be very gentle with it. Okay? Think of it as if you're having dinner with a very beautiful girl. You want to be very gentle with her. Just go back and forth. Take about 10 to 15 times. Okay, after that, then you've created this homogeneous material. The needle is 1.5, so it does not go beyond 1.5. I will always have I will have 0.3 here. Okay, and this I will use later on. Okay? Alright, very good. Alright, excellent.
Which needle now you're going to?
I hope they provided me with this needle.
Ahmed, أنت جايب أنهي واحدة؟
28 or 27.
Okay. Alright, let me explain this needle. The needle for Radiessa usually comes with the distributor here is the Excel needle. The Excel needle is a 28 gauge needle. Okay? But the bore of the needle is a 27 gauge. So this is a 28 gauge thin-walled needle. Okay? So it feels I'm using a 27, but it is sharp and thin as a 28. Okay? Does that make sense?
Yeah.
Alright, good.